Hi everyone, we are Glioma Freaks, and before we start our presentation, I would like to introduce our group members. This is our group photo, and starting from the middle, which is our teacher advisor, teacher Alice, and from the left until the right, which is Tan Xianyu, Ya Huidong, Edra Lee, Cocker Wei, and lastly Wan Yixuan.
Our poster is about glioma, an unpredictable trait. And now, let me first introduce what is glioma. Gliomas are actually a diverse group of tumors which are originating from glial cells in the brain and spinal cord, representing the most common primary brain tumor within the central nervous system. These tumors vary widely in their aggressiveness and prognosis, ranging from low-grade pilocytic astrocytomas to highly malignant glioblastomas, which is the most common and aggressive type of primary brain tumor in adults. Before we go through the type of glioma, do you guys know that every third of Wednesday of July is actually an awareness day? That day is named Glioblastoma Awareness Day. So next, there are actually three types of gliomas, which are astrocytomas, oligodendrogliomas, and ependymomas. For astrocytomas, it originates from astrocytes and can be encapsulated, preserving clear borders between normal brain tissue and tumor cells, or infiltrative, indicating a higher grade lesion. Next, oligodendrogliomas originate from oligodendrocytes and are less infiltrating than astrocytomas. They are commonly found in middle-aged adults. Lastly, ependymomas originate from ependymal cells that line the ventricular cavities and the central canal of the spinal cord. They are more common in young children. For next, this is a graph titled with the population of glioma in Terengganu, Malaysia. From this graph, we are able to know that the cases diagnosed are actually less than the other countries.
Glioma is caused when cells in the brain or spinal cord develop change in their DNA. These mutations disrupt normal function and lead to uncontrolled tumor growth. But these tumors don't just form in one area. They can appear in many parts of the brain and spinal cord. In the hemispheres, the brain's largest region, both low and high-grade gliomas are common. In the midline, tumor growth deep in the brain and are often harder to treat. The pineal gland, located near the center, can be affected in both children and adults. In the pons and spinal cord, high-grade gliomas and ependymomas often appear, especially in children. And in the cerebellum, at the back of the brain, low-grade glioma are more common, again typically in kids. So, who is most at risk? Age is one factor. People between 45 and 65 are commonly affected. Certain types of gliomas, like low-grade astrocytomas, are actually the most common brain tumors found in children. Other risks include exposure to radiation, genetic disorder, and a family history of glioma. Do you know your job might affect your risk? Industrial workers, healthcare professionals, and agricultural workers face higher chances of developing glioma. This is often due to exposure to harmful chemicals or radiation in their work environment.
Now, we will take a look at glioma's symptoms. Based on a case study about potentially treatable symptoms in glioma's patients by Jantine G. Rogering, top 5 common symptoms of glioma were fatigue, memory problems, reduced physical fitness, concentration problems, and drowsiness. Over half of the patients has experienced 3 or more symptoms simultaneously. Glioma's dormancy, which is glioma patients that haven't shown symptoms. The symptoms only appear when tumor starts inhibiting surrounding brain tissues. This growth would take couples of years or months. However, through MRI scans, the tumor could be seen appears as a mass in the brain or spinal cord. Depending on the size, type, locations, and rate of tumor growth, the duration for glioma symptoms to appear may vary. For instance, if glioma develops in a highly sensitive area of brain, symptoms may manifest sooner. Next, we will look at symptoms of low-grade glioma that grows relatively slow and high-grade glioma that grows faster. Symptoms for low-grade glioma are less severe, such as headache and loss of balance. Speech and vision problems appears in those who have tumor within speech area and back of the brain. While for high-grade glioma, the symptoms are personality change, cognitive decline, and seizure when tumor grows at frontal or temporal lobe. These also involve some life-threatening symptoms like brain hemorrhage, that is, bleeding in the brain.
Unfortunately, there is no guaranteed way to prevent gliomas, but there are still preventable ways to restrain and minimize the probability to get glioma by adopting a healthy lifestyle and minimizing environmental risks, which can reduce the risk of getting glioma. This includes avoiding excessive radiation exposure, refraining from smoking and limiting alcohol consumption, which can build up a better immune system to stay away from this cancer. So firstly, we have to maintain a healthy lifestyle. Having a balanced diet is one of the best preventions among the other prevention methods. A diet that is rich in fruits, vegetables, whole grain, legumes, nuts, and fresh fish facilitated the reductions of risk of glioma cancer. Additionally, there are certain dietary patterns like the Mediterranean diet or MIND diet. Secondly, we have to minimize the environmental risk. When mobile phones are not used, it should be switched off or set to airplane mode. Children and especially toddlers should be kept away from their use to reduce the ionizing radiation exposure. Besides that, people and farmers in particular should protect themselves during pesticide use.
Before glioma treatment, we need to have a specific treatment plan which depends on the type and grade of gliomas, malignancies, genetic growth rate, location within the brain, and the overall health of the patients. The first type of treatment is surgery. Craniotomy is the most common type of surgery to remove gliomas. Depending on the size and location of the tumor, digital ablation is used to destroy brain tumors. The surgeon may remove as much of the glioma as is possible. This procedure is called a subtotal resection. Of course, surgery carries risks. These include infections and bleeding. Other risks may depend on the part of the brain where the tumor is located. The second treatment is radiation therapy. They are often used after surgery, which is using beams of powerful energy to kill tumor cells. This energy can come from X-ray, protons, or other sources. Radiation therapy targets the extract of the tumors, minimizing the risk of damage to surrounding tissues. Next is chemotherapy. Chemotherapy uses drugs to kill tumor cells. Chemotherapy medicines are most often ordered, which is taken in pills form or intravenous, which is injected in the vein. Tumor treating field therapy often done at the same time as chemotherapy, which is using electrical energy to hurt glioma cells. This type of treatment is used to treat an aggressive type of glioma called glioblastoma. So here's the question, is glioma curable? For low-grade glioma size, petastatic astrocytoma may be more curable than other types of gliomas. However, high-grade glioma size, glioblastoma, are more difficult to cure. These tumors tend to grow quickly and spread aggressively, and they may be resistant to treatment. While surgery, radiation therapy, and chemotherapy can help slow the growth of this tumor and prolong survival, they are generally no curative.
Thank you for attention, and we hope that you have learned something new or something interesting about glioma cancers. If you are interested, kindly refer to our posters for more information. That's all from our group. See you guys next time. Bye.